I'm going to show you now and tell you about my research, my PhD research, that wants to look a bit different look about how to investigate ApoE. I'm going to use the eye as a model for investigation of ApoE-induced neurovascular pathologies. Okay? We tend to see the brain as a big organ of neurons, but we tend to forget the other half of the equation, that the brain is also filled with blood vessels. And it won't be smart enough to investigate just one system without referring to the other one. So we use the eye for this purpose. Why the eye? Because the eye has a very specific architecture. Okay? We can use the retina to investigate the neuronal part. In the retina, we have very specific and distinct layers of neurons and the synapses that lie beneath them. And also, we can look at the vasculature of the eye when we have two distinct vascular systems. One is a choroid that lies on the back of the eye, which nourishes all the photoreceptors there, and a different system of the retinal vasculature that gives all the nutrients for the inner parts of the retina. So, as I said, the objective of my research was to investigate the effects of ApoE4 on both neuronal and vascular system of the eye. And to do so, we first want to look, in opposite to what Danny said, we first look on behavior or functionality of the retina. Then we're going to look on the suspects, and finally to look on neovascularization as a system to investigation of vascular system. So ERG, or functionality of the retina. What is ERG? Electroretinography. We take a dark adapted mouse, we introduce them to increased light intensities, and we measure the response of the retina. The typical response of the retina produces two waves, the A and B waves. The A wave refers to the response of the photoreceptors, and the B wave refers to the response of the bipolar cells. When we performed this test on ApoE3 and ApoE4 mice, we see that the ApoE4 mice responded differently from the ApoE3. Specifically, both the A and B wave of ApoE4 mice showed lower amplitudes in response to those specific flash intensities. Okay, so now we see that ApoE4 induces functional impairment of the retina. We saw that by showing the reduced ERG response. And now we go to the obvious suspects, which are the synapses, of course. If we look on this retina, we see this is the photoreceptor layer and the bipolar cells, ganglion cells, and in green we see the synaptic layers. So first of all, we have to go and measure synaptic density. So we use synaptophysin as a marker for total synapses. We already see here in both layers, both synaptic layers, lower levels of synaptophysin in ApoE4. When we wanted to look specifically on the type of synapses, we used two markers. The first marker for excitatory synapses, VGLUT. We saw a trend of reduced levels in ApoE4 with a similar but opposite trend in the inhibitory synapses in higher levels in ApoE4. When we looked on the ratio of VGLUT to VGAT in each mouse, okay, we saw that the ratio of VGLUT to VGAT was lower in ApoE4. So those of you who don't believe in immunohistochemistry, we performed the same test with immunoblots, and we got the same results, mainly lower synaptophysin levels or synaptic density in ApoE4 mice, and impaired balance between VGLUT and VGAT ratio. That's what I just said, and this was published lately in PLOS ONE, and now that we have this basis of that we know that ApoE4 influences and impairs the neuronal part of the retina, we want to go to the vascular part of the eye. In order to do so, we used a method or a model called the laser-induced choroidal neovascularization, which is a very well-established model to induce choroidal neovascularization. Our very own Dr. Evil was Professor Dov Weinberger from Beilinson. which performed physically performed the laser hits. What he did, we took the young naive mice, we anesthetized them, of course. This is the retina, okay, illustration of the back of the retina. These are the photoreceptors. This is the choroid that lies on the back, and the retinal pigmented epithelium that lies beneath those two layers. This is the eye of the mouse as observed through a magnifying lens. Okay, what Dov did, he shot laser shot at the RPE, destroying it, and he did 4 radial shots around the optic nerve, and allowing the blood vessels from the choroid to penetrate into the retina. Okay, what we did, the next step in order to assess the neovascularization, I took the laser hit eyes, I separated the lens and the retina, which left me with the choroid and RPE layer. I dissected it in 4 points and flattened it on the slide and stained it for blood vessels. Okay, so this is the choroid flattened on the slide, and these are 4 hits stained for blood vessels. We can see that already at 3 days there's a nice growth of pathological blood vessels. We performed the same investigation in another 2 later times, 14 days post laser and 60 days post laser. Okay, and if we want to investigate what is the mechanism that is going on there, then we can see in 3 days a large hit, and slowly scar is starting to form in the middle of each hit, which gets very large at 60 days post hit, and we can use several parameters to measure what's going on in here. Okay, first of all, we can measure the area which is covered by the blood vessels, okay, of the hit. The second one is look on the intensity of the staining in that area that we measure, which indicates the density of the blood vessels. Another parameter that we can use is the scars that lie in the middle of those hits, and again we can count the number of the scars per hit and quantify it in percent, and also measure the area. Okay, so we started to do that, and when we looked on the blood vessel area, we saw that 14 days post laser hit, no different. The scar area, the blood vessel area stayed the same, with mild reduced area after 2 months. And when we looked on the density, we saw that ApoE4 showed already at 3 days and 14 days a bit lower levels at 16 days, higher levels of blood vessel densities in ApoE4 compared to ApoE3. Okay. When we looked on the scar tissue, we quantified the number or percentage of scars per hit. So at 3 days there are no scars. Okay, 33 hits, 38 hits, no scars. When we looked on 14 days, we saw that 50% of the hits formed some scars, but no difference between ApoE3 and 4. But when we looked in 60 days, we saw that almost all of the ApoE3 mice formed scar tissues, with only 62% of the ApoE4 did the same. When we measured the area, already at 14 days, we saw that the area of the scar is lower in ApoE4 and significantly lower in ApoE4 at 60 days, with higher area, of course, because the scar is getting bigger and bigger. Okay, so our conclusion for this is that ApoE4 increases the response to choroidal injury, and we can see that by looking at by inducing higher neovascularization and reduced or slower scar tissue formation. Okay, so now we saw that, and we have seen that ApoE4 impairs both systems. We ask ourselves whether we have a common mechanism that can link those two mechanisms, two pathologies. So the main suspect that came up was VEGF, specifically due to that increased neovascularization. Just to let you know, those of you who don't, VEGF family is a very large family, okay, with many ligands and not so few receptors. VEGF is well known to be involved in neuroprotection and in vasculogenesis. Okay, so how does ApoE4 and VEGF together get into the picture? In terms of neuroprotection, we looked on the young, naive animals' retina that, as you remember, had impairments in functional synapses. Here we saw lower levels of VEGF. Okay, when we look at the vasculogenesis, we looked on the choroid. Again, just to remind you a few slides ago, higher neovascularization. Again, so here we saw VEGF higher levels in ApoE4. Okay, then to conclude this, just one important point. We saw that the lanes didn't look the same at the retina and the choroid, which make us think about different isoforms or something. And we see that ApoE4 downregulates VEGF, the specific isoform 43 and 47 kilodalton in young retinas, and upregulates VEGF, different isoforms in the laser choroid, which leads us to conclude for future work that our hypothesis is going to be that the effects of ApoE4 are neuronal and vascular, and it is differentially and selectively mediated by different isoforms of VEGF. That's all. I want to thank Danny, my boss, Shiran, for helping me a lot in this project, all my other lab members and our collaborators, specifically Dov, who performed the laser treatments. Thank you.
So, Ryan, you forgot to tell us at what age were the animals?
Yeah, I know I forgot. I thought about before I'm going to lecture, and I said I'm going to say it, and I forgot. These are young animals, 4 months of age, the retinas, and the choroids. All the animals were ApoE3, ApoE4, the same animals that Danny told us about in brain part, young naive animals.
But it is important to follow up and to see whether there is a change with age. Alzheimer's disease is an aging-related disorder. And if you want to believe that what you found is relevant to the Alzheimer's issue, then at least you should try to find out whether older animals behave in a different way than younger ones.
That's right, and in these days we perform a joint project with Professor Onofri and Raya from the Hebrew University, examining age dependency of all those pathologies starting from 2 months and to the age of 12 or 15 months. So we're undergoing, the research is undergoing these days.
Yeah. I am not aware, but maybe I am wrong, that Alzheimer's patients have more lesions than age-related compared patients. I guess that you have looked.
In what terms? I didn't understand. What lesions?
Retinal lesions in the eyes.
AMD.
Yes.
Okay.
AMD or problem with laser treatment after if they're diabetes?
I am not aware that.
No, but it's important to see if patient or people with ApoE epsilon 4 homozygous have more problem. These are the ones you should look at.
There are several problems in this field regarding your question is very good because it's very complex. The answer is very complex. A lot of essays and reviews talk about the similarities between Alzheimer's and AMD and glaucoma. But it is also known, and I didn't say it because it goes, it's not truly understood now, that in AMD, ApoE4 seems to be a protective factor for some reason, unlike in AD. But we don't know what's the deal over there. I don't know. Nobody knows, and I don't have the answer for that.
You need to collaborate with Dr. Rossi that he has a big population of patients.
Maybe we would. That's the purpose of those groups.
So how do you explain the upregulation?
You switch places.
Be careful, he's getting
No, he was there and now he's here. Sorry.
The upregulation of VEGF in one site and the downregulation in another site.
Okay, we don't understand it now. That's going to be Shiran's PhD. Okay, she just went into the lab as a new PhD, and I'm graduating my PhD, and that's going to be her big PhD project. We don't know yet, but what was interesting and what made us think that it is interesting is the different isoforms. in the retina and in the choroid. Okay, it was not. It didn't pop up. Danny noticed it. That in the retina we saw those two bands. We don't know the meaning of it yet. It's very, very preliminary results. Okay, it's from, I don't know, 2 weeks ago. And in the choroid we saw other isoforms expressed. So we don't know it, but it is for sure very, very interesting. And Shiran, good luck. Probably.
Can you repeat the question, because we did not hear the question?
No, just.
She said it would require different therapeutic approaches. If we have,
Or whether the same therapeutic that is directed towards ApoE will differentially affect the isoforms.
Yeah.
That we can reverse in one part and not in the other.
Okay.
Thank you.
Coffee?
So we have a few minutes for coffee. Please come back. We asked the